Good morning, I'm Amy Lynn. The American Gastroenterological Association launches IBD Parenthood Project and a new online resource on family planning. And here with more are patient advocate Jessica Karen and Dr. Christopher Robinson. And it's really great to have you both on this morning.
Good morning.
I think IBD in general is something that people don't talk about too much, even though they may have it. But when you're talking about making additions to your family, there's concerns there. So doctor, I wanted to start with that. If a woman has IBD and wants to have a baby, is it still possible?
Absolutely. So one of the major concerns is, can I get pregnant? Can I have a baby? And the answer to that is actually fertility is relatively normal as long as the person has good control of their inflammatory bowel disease. So you'll hear us come back oftentimes to discussing control of the disease, and that's really key in getting to a healthy pregnancy outcome for that mother and her baby at the end of the pregnancy.
So when you're taking this next step, which providers should women involve in their care?
It's interesting that this is one of those situations where a woman actually needs a team of providers. She needs a key person that's taking care of her IBD, and that's going to be a gastroenterologist. She probably already has one that she can go in and have this discussion with. But one of the things that women often have is they have some fears. They have fears of bringing up the question of planning a family. They have fears that they may be told information that they're concerned about as to whether they can get pregnant or have a family. So one of the keys that we have brought to the table today is a toolkit that's available to women as well as their providers, that they can actually go online to ibdparenthoodproject.org and receive that information.
Now, Jessica, as a patient, what were some of the concerns that you had when you were first starting a family?
Well, Dr. Robinson nailed it on the head. I was wondering, would I be well enough to have a child? And what would be the right choice for me in managing the disease, for keeping myself healthy, but also what would be the smart choices for my baby?
So what kind of tools can patients use to guide them?
Sure. So I'm really excited about the toolkit because it wasn't available to me back when I had my children, and it's part of why I became an advocate, was to have resources like this available to women. So online at ibdparenthoodproject.org, women can find information on misperceptions and some facts, as well as checklists to give great guidance and talking with the clinician directly about planning, preconception, pregnancy, postnatal care, and even breastfeeding.
Thank you both so much for coming on this morning. Of course, you can find out more by logging on to our website, which is fox4morningblend.com.